Hi, Emma. Thanks for taking the time to meet with me today. I'll be presenting a case formulation for Sophie, who's a 15-year-old referred by her school wellbeing coordinator due to ongoing academic, attentional, and emotional difficulties. For this session, I'm going to focus specifically on her low academic self-esteem. She frequently describes herself as stupid and feels like she's falling behind her peers. From a CBT perspective, what we're seeing is that these beliefs are acting as a key maintaining factor. So when Sophie has thoughts like, I'm stupid, that tends to trigger her anxiety and lead to an avoidance behaviours. Things like procrastinating, disengaging from tasks, or not asking for help. Over time, this creates a cycle where her academic difficulties continue, which then reinforces those negative self-beliefs. So overall, her self-esteem just doesn't sit alongside the problem. It actually seems to be the driving and maintaining factor for both her emotional distress and her academic difficulties. So in terms of goals, the broader aim is to improve both Sophie's academic functioning and her emotional well-being. That includes building her confidence in her abilities, reducing her school-related anxiety, and increasing her engagement with academic tasks. But for this session specifically, the focus is more targeted. I want to help Sophie start recognizing and challenging her negative automatic thoughts, particularly those related to her academic abilities. And that's important because these thoughts seem to sit right at the center of the cycle that we're seeing. They are driving her anxiety and they are also contributing to her avoidance. So by targeting these thoughts early, we're not just addressing the surface level symptoms and issues, we're starting to intervene at a level of the underlying mechanism of the maintaining problem. And ideally that creates a foundation for long-term cognitive and behavioral change. So for this case, I'm going to be using cognitive behavioral therapy, or also known as CBT. CBT is really well suited to Sophie because her presentation shows her difficulties reflect a clear interaction between her thoughts, emotions, and behaviours. So these negative thoughts about her academic ability, which increase her anxiety, and that tends to lead to the avoidance behaviours like procrastination or not seeking help. CBT directly targets that cycle. It helps individuals identify unhelpful thoughts, evaluate them, and then gradually replace them with a more balanced and realistic alternatives, while also introducing behavioural strategies to reduce these avoidance behaviours. For example, Judith Beck's CBT model emphasizes that identifying and modifying core beliefs, like I'm stupid, is essential for replacing lasting emotional and behavioral change. And that's particularly relevant here for Sophie because her beliefs seem to underpin a lot of her difficulties. There's also strong evidence to support CBT in adolescence. For instance, it's been shown that CBT interventions targeting self-esteem leads to significant and sustained improvements over time. So overall, CBT is both theoretically appropriate and strongly evidence-based for Sophie's presentation. I'd also draw slightly on her behavioural activation principles, particularly to address her avoidance. Increasing structured engagement in tasks can help break that cycle between low confidence and disengagement. There are also a lot of process issues that could impact the effectiveness of this intervention. And it's really important to plan for these in advance. So starting with client factors, Sophie's low self-esteem and sensitivity to criticism may make her hesitant and engage in cognitive restructuring. She might experience it as her thoughts being challenged or invalidated. So to manage that, I would take a really collaborative approach, using gentle questioning rather than direct confrontation. So instead of saying things like, that's not true, I might ask something like, what's the evidence for and against that thought? Or is there another way of looking at this? That way, she's arriving at an alternative perspective herself, which helps reduce her defensiveness and increase her engagement within the session. Her attentional difficulties are another important factor. She may struggle with longer or more abstract tasks. So, in response to that, I'd keep activities brief, structured, and very concrete. For example, working through one specific situation rather than multiple examples. I'd also check in regularly with her to maintain her engagement within the session. And in terms of avoidance, there's a risk she may not want to complete any homework tasks that are set for her. So, to address that, I'd make sure the tasks are very small, achievable, and clearly linked to her goals. I'd also frame them as experiments rather than expectations to help reduce that pressure. From a clinician perspective, it'll be really important to maintain a validating and supportive stance throughout the session. If I move too quickly or become overly directive, that could reinforce her sensitivity or to criticism and reduce her engagement throughout the session. So, pacing is really key here, making sure she feels comfortable, supported, and successful early on. And although she is not currently reporting any self harm or suicidal ideation, ongoing monitoring of the risk is still really important for Sophie, given her low self esteem and her daily anxiety. And now, because Sophie is only 15, confidentiality needs to be handled carefully. I'd make sure she understands the limits of confidentiality from the outset, particularly around the safety concerns, while also maintaining her sense of privacy and trust within the session. At the same time, some level of communication with her parents and with the school, if allowed and being given approval, is really important, especially to support her outside of the sessions. I'd aim to involve them in a way that feels collaborative rather than intrusive. For example, sharing general progress and strategies while respecting Sophie's confidentiality around more personal content. So, overall, the approach needs to be flexible, collaborative, and really tailored to Sophie's developmental level and her needs. So, in terms of how the session would run, this would be a structured 50-minute CBT session. I'd start with a brief check-in and agenda setting. This would be around 5 to 7 minutes, roughly, just to get a sense of how she's been, particularly with school, and collaborate with her and decide what the focus will be on. This also helps build rapport and gives the session a structure. Then I'd move into some brief psychoeducation about the CBT model. This would take approximately 5 to 8 minutes. I would explain how her thoughts, behaviours are connected using one of her recent examples. This is important because it helps externalize a problem. So instead of seeing herself as the problem, she starts to see a pattern on how we can work on this. From there, I would guide her through identifying a recent situation and her negative automatic thoughts. This would take about 10 minutes. Would look at what she was thinking, how it made her feel, and what she did in response to it. Then I'd move into cognitive restructuring. That would take about 10 to 12 minutes. Using guided discovery, I would help her evaluate one key thought, like something like, I'm stupid, and develop a more balanced alternative. Importantly, I'd go at her pace here and make sure she feels supported rather than challenged. After that, I'd introduce a behavioural strategy, specifically task breakdown. That would be about 8 to 10 minutes. Together, would take a school task and break it into smaller, more manageable steps. This is really important for Sophie because it reduces the overwhelm and gives her a sense of control and achievement. From there, I would then set a simple homework task, roughly 3 to 5 minutes. This would involve noticing her negative thoughts and trying the task breakdown with one piece of schoolwork. I'd make sure this feels achievable for her, giving her tendency to avoid things. Finally, I'd finish with a brief summary and feedback, just reinforcing what we've covered, checking in on how she's feeling about it all. That would be about 3 to 5 minutes as well. So, overall, this session is really about starting to break down that cycle between Sophie's negative self beliefs, her anxiety, and her avoidance behaviours. By helping her recognize and begin to challenge these thoughts while also introducing manageable behavioral strategies, the aim is to gradually build her confidence and increase her engagement within school. And over time, that should support improvements in both her emotional well-being and her academic functioning. Thank you so much for meeting with me today, Emma. I appreciate you taking the time, and I can't wait to hear about any feedback you have with my session before I give it to Sophie. Thank you.